Hey you guys, it's Tuesday again. We're on a live feed. I want to thank you guys for being here. Today we're going to be talking about our last topic this month, functional approaches to healing the gut. And with this, today we're talking about case studies. So previously we covered the irritable bowel, Crohn's, ulcerative colitis, proctitis, inflammatory bowel disease, and we even talked about some of the lab work that we did before. So that was pretty cool. Gave you examples. Those are all downloadable off that slideshare.net link that I sent you guys. You can look at all these videos under the videos on my Facebook page.
I don't think we're on.
All right, technical things. See, there's 2 people watching.
Oh, there are?
Yeah, so it started.
Oh, good. Okay.
For some reason, we're not seeing it on our end.
Okay.
So Rachel's there already, see? So that's pretty good.
Oh, good deal.
All right, so we're live. New technology, we're trying to figure this out, you know? So each episode, there's an Easter egg or something unique in there. And if you guys can figure out each one, each of the 4 for the month, then you can get a free office visit. Just make sure that you send it by messenger, the ones that you think are the unique things. And the winner will get that, but don't post it on the Facebook thing because then other people will figure them out and beat you to the end. So now next month we're talking about something really, really important. So one thing I love is gut stuff because gut stuff's so easy to fix. The other thing that's really important, it's about the same proportion of people that end up having the same amount of problems, which is about 1 in 5 as gut problems, is anxiety and depression. And you know, we have really great success with it, but we're actually going to step further next month. So September we're going to talk about something called proteogenomic approaches to treating anxiety and depression.
Proteo what?
That's crazy. That's like a $1 word right there.
Wow. Yeah.
50-cent word.
Yeah.
So
sure.
Proteo means proteins, which refer to proteins that your bodies make, like neurotransmitters and kind of gene outcomes. And the genomic is the gene part. So we literally, these are for patients that are hard to treat, that aren't responsive to medicines or even supplements. So you have some people that have gene polymorphisms that we can test that actually will metabolize medications faster. They'll metabolize supplements faster. Some won't metabolize them at all. But it gives us a greater insight into really creating a tailored treatment for that patient's unique genetic makeup. And so a lot of times you hear people all the time saying, well, I tried this, it didn't work, you know, none of these meds ever work on me, or, you know, I always end up with side effects. And that's why is that genetic polymorphism that we actually look at. So it's a very unique approach, and it's cutting edge. And there's only just a handful of people in the entire world even looking at that approach. And I have actually happen to be a part of a group that's doing research on that. So hopefully we'll be putting out some published studies and really changing the way that people or doctors approach that prognosis and treatment for those patients, so we can actually get better therapeutics. So that's not next week, because next week we're not having a topic, but we'll probably do something pre-recorded. So I might send out that reading from that 1910 book that I've been promising, or we might do something special too. So I'll put that out. We might have a live recording, but we're trying to get that proteogenomic thing together so we can release that for each week. So today we're talking about case studies. My name's Patrick Garrett. I'm a functional medicine doctor. I do clinical nutrition, functional medicine, integrated medicine. I have 4 board certifications. I've taught postdoctoral diplomate courses all throughout the U.S. and I have patients all over the world. And when it comes to case studies for gut stuff, we have a wildly successful success rate. So I love it. I really love gut patients because of that. That tissue turns over so fast, and if you can figure out what's causing it, you really rock that person's world. You get their life back. And joining us, we of course have Holly. Hajaj, and she's the clinic wellness director, and she also a yoga instructor, and so she's all about mindfulness and wellness and helping patients along.
Yeah, a holistic approach. I think you just can't beat that in terms of prevention. So many of our solutions here in Western medicine are short term, and so, or band-aids. And so what we're doing, I'm really excited about, or what Dr. Garrett is doing. I call him Dr. G. That's Dr. G for genius. What he's doing is really exciting. And I think that we can solve problems in a long-term way, in a permanent long-term way, by getting educated. So I'm happy to be here.
Yeah, you know, the goal we always go after is, I love it, I seen a t-shirt once for Crohn's disease, but it said we want cure, not chronic management. And that really spoke to me, and I love that aspect. And that's what when we used to teach doctors clinical nutrition and functional medicine, the goal was always, how do you reverse and restore normal function, not how do we chronically manage with supplements or medications.
Yeah.
And it's a wildly different approach, wildly different.
Or surgery, right?
Right, yeah.
Right.
So, as you guys post stuff, if you have questions, feel free to put them out there. I love that you guys are attending, and if you have questions, post them. Comments, post them. If we get a chance, we'll answer on the air. Otherwise, I'll follow up afterwards and try to answer any of those questions too. So otherwise, we'll get started. So one of my favorite cases is always the hardest cases. So the patients that have been everywhere and nobody could figure out. We actually had a girl one time, I don't think I told you guys about this, but she sweated blue, right? So she stained her shirt blue, her purse blue, or her watch blue, and she did this for, I don't know, a decade or two, and we cured her. And she, you know, her mom asked, well, her mom was pissed. You know, she said, why did it take all this time for someone to figure out what's causing this and treat her? And I said, it's basically, I'm the only guy that actually was willing to do some research. And so I love those hard, tough cases that people have been everywhere, saw everything, and then we get a chance to help them. So one of the cases then is a 40-year-old male, and this guy, I think Sherry mentioned him last week maybe, but he was the one that came to us from his gastroenterologist, and even his gastroenterologist was like, this is the worst I've ever seen in my entire practice. And so I was very excited because I thought, well, we're going to rock your world here.
The worst what?
Oh, case of ulcerative colitis.
Okay.
Yeah. So this guy, you know, ulcerative colitis is where the immune system is attacking the tissue of the gut, usually in the colon, but it could be upper GI too. And with that, you end up destroying tissue and eroding the tissue until you hit bloodstream. And once you start hitting those blood vessels, they start bleeding sometimes profusely. So this guy was bleeding like a stuffed pig. He was also having tons of mucus production because it's a very strong inflammatory disorder. So he's just like, you know, a lot of times all the bowel movements he has isn't even bowel. It's just mucus, lots of mucus, and it's very
disturbing.
Disturbing, yeah. So it's kind of like he had a runny nose in his butt, if you will. Is that a good description?
That could be a very, very good description.
He has sinusitis of the colitis.
Yeah, I like that medical terminology.
So he was going like 20 times a day too.
Oh, wow.
So, you know, 20 times a day and just a mess. You can't live a life like that. And he was to that point of just like utter frustration. I mean, you know, he's got another 40, 50 years left in him, and he can't drive anywhere without possibly stopping on the side of the road and fertilizing the ground.
Well, and he probably has to. I mean, there are times when he doesn't make it to a place to go.
Yeah.
Yeah.
So yeah, and that's an issue with a lot of our patients. That, I mean, when that urgency gets so bad, I mean, there's just not that place. I mean, we had patients that are IBS runners, and they're running marathons, and they have a lot of times that they're pooping in your bushes. So if you ever see somebody,
don't judge.
dropping trowel, You just say, hey, I understand what you're going through. You need to go see Dr. Garrett. And just walk over, hand him my card after you hand him toilet paper. Because then they'll use my card. So that's not cool. So this guy, I mean, he was just really to the point of no return here. And, usually they end up on a few medications. And this guy was on your typical Ascol, which is salazine, but it was enema. So every night he has to give himself an enema before he goes to bed of this anti-inflammatory, which is kind of like it's a 5-ASA, and that salicylic acid in there, that's like aspirin. So it's kind of like a glorified aspirin, if you will.
Hang in there, those of you who are faint of heart. Hang in there. So
it's kind of gross. I mean, this sucks.
You got to do what you got to do, though.
Very, maybe not romantic, doing that before bed and getting in bed with your wife. So, I would always make sure he was facing the outside in case I tickled him or something. Well, I wouldn't. It's her. Right.
Trouble.
It broke back down here.
Trouble.
Right. So, it's a whole mess. So, he came to us at that point of like, everything's failed. So, what do we do? So, typically, what we want to do is do a very standard food-based protocol, which is maximize the good, minimize the bad, identify the key inflammatories, and get rid of those and see if the patient improves. Mm-hmm. And used to, back in the day, I would get very, very, really detailed and very complicated. And I figured out over the years of really teaching this stuff, more so than practicing, how well we could refine it down. And so my clinical practice basically narrowed this down to just a handful of steps that really is the most effective. And then if that solves the problem, great. Simple. At least simple from my standpoint. And then if we have to get complicated, then we have to get complicated. So there's been a couple patients that, man, I have to really research and spend time, and it's no fun being up to 2, 3 in the morning looking through research, trying to find that unique thing that's about that patient. But that's far in between now, these days.
So you'd say the majority of the patients you're able to find solutions for.
Yeah.
That includes you who are watching.
That's right. We see you, because we got a camera on the other side, and we can see you.
Right.
We just type in Google gut problems, and video, and then we can... No, I'm just
right into your home.
Right into you. Just like 1984.
Sorry.
You even list your bowel function on there.
Yep.
So, the first thing is, patient comes in, and we go through the whole report of findings and just say, or not whole report of findings, but the whole list of things that's going on with that patient. So we want to know everything that person's eating, drinking, peeing, pooping, sleeping, everything. Not just the bowel function, but how is their whole lifestyle looking, and how kind of far off are they? Because we have some patients that, they get some minor stuff, but that's a different case than the people that just every single thing is falling apart. They'll end up with 50 major things falling apart. So that person, we know how aggressively we have to treat them. Well, with this guy, it's pretty typical. By the time they get to the point where they see me, they've seen everybody else, and everything's kind of falling apart. And those 2 enema medications that he was taking also deplete some very specific nutrients, which then lead to all kinds of other symptoms.
Yeah.
So as long as they chronically do that, then they're going to have the chronic depletion, they'll have chronic symptoms, and then it becomes a disease, if you will. So we then look through and where we can change dietary stuff. So I look at what are they eating that's inflammatory, what could they change to anti-inflammatory. So the first key in doing a very effective treatment for this is dramatically decreasing the inflammatory foods that person's consuming. And you have 2 basic fatty acids, though you have several, but 2 major ones that are going to really affect gut patients. And one is omega-3, and one is omega-6. Omega-3 is from wild-caught fatty fish, free-range chickens, grass-fed, grass-finished beef, and that meat eats anti-inflammatory food, and then we eat that meat, which then becomes anti-inflammatory fats to us. And that literally can knock down pain and inflammation, especially fish. So when you think about you got a headache, so you take an ibuprofen, right? Ibuprofen is, let's put it this way. 1 serving, or 3.5 ounces of fatty, cold water, wild-caught fish, like tuna, salmon, halibut, mackerel, cod, sardines, is just as effective as one ibuprofen for getting rid of pain.
What?
Yeah, with no kidney failure.
Like immediately, not like tomorrow, but today.
Right. Because they're what are called 5-LOX inhibitors, and they also block a little bit of COX-1, COX-2, which is what aspirin, ibuprofen, and prednisone block. And those fatty omega-3s from those fish actually regulate all three of those pathways.
I was going to ask you I've been wanting to ask you through all these talks what you thought a good over-the-counter treatment was when someone's in trauma, when someone's in the midst of an attack, and that sounds like a good answer.
Right, and you can do additional omega-3s, like a Carlson's cod liver oil would be like phenomenal. You just want those EPAs and DHAs and maybe even ALAs for like chia and flax to add up to about 1,000 milligrams. So the front of the fish oil might say 1,000 milligrams, but that's of the actual oil. So you want the active ingredient, which is omega-3, and so you can add those up on the back. So that gives you your therapeutic value.
For a dose?
Right.
1,000 milligrams per dose per day?
Oh, like 3,000 if you have gut stuff, or if you have any type of chronic inflammatory things, because that'll knock it down dramatically. Fatty fish, cold water fatty fish, wild caught, is your fastest way to reduce inflammation through diet.
Okay.
And with that, then, so you want the patient to make sure not to eat corn-fed chicken, corn-fed fish, corn-fed beef, because the omega-6 that's in the corn, the omega-6 that's in the soy, not only is that genetically modified, but that is highly inflammatory. And, in nature, there's a balance. So, omega-6s are not problems. Omega-3s are not the wonder thing. The balance is really the most important thing. Maximize good, minimize bad. So, in nature, it's about a 1-to-2 ratio. Twice as much inflammation as anti-inflammation when it comes to omega-3s and omega-6s. So in nature, that's how it occurs, and so you don't have to figure it out if you just eat real food. But if you look at the balance of the American diet, right? And so in 2006, the American diet became the leading cause of preventable death over smoking, which, last year the World Health Organization said that American meat's now more toxic than smoking cigarettes for causing cancer. But that inflammatory part of that food means that the American diet is 40 times more inflammatory than anti-inflammatory. We get 40 times the omega-6s, which the number one thing those prostaglandins do from omega-6 is cause pain and inflammation. So if you have a chronic pain inflammatory condition, which is 3 out of every 4 Americans in the U.S. now, you got to change that diet part. I mean, you can't just take turmeric and take ginger and take ibuprofen and aspirin and keep eating inflammation.
Right.
You can't do it.
Right.
It's a losing battle.
So I always have a hard time remembering 3 or 6, but now that I'm sitting here, I'm thinking 3, I think trilogy or trinity, or that's the one you want to keep, right? That's one you want to add to.
Yeah. So trilogy, health, happiness, and longevity.
Omega-3s.
Yeah.
Okay.
And omega-6 is double trilogy, which cancels each other out, and that ends up with no trilogy.
Oh, okay.
No, I don't know.
All right.
That's nerdy.
He's doing Dr. Garrett math.
So the inflammatory part of the diet, right? So if you have gut problems, that's the first thing that we did, and that's what we did with this guy. The other thing is add in all the anti-inflammatory foods too. So once you cut out that inflammatory part, then you want to really pack in anti-inflammatory stuff. So like turmeric. Do you use turmeric at all?
Yeah. Yes.
Yeah. So turmeric's just a yellow root.
Yeah. Dirt
cheap, orange, I guess. And it is a powerful COX-2 inhibitor, just like Celebrex, Bextra, Mobic. Even Vioxx that got pulled from the market. Turmeric and ginger both are very powerful COX-2 inhibitors.
What does that mean again? Can you remind me? COX-2 inhibitor?
Well, so you have 3 doorways to pain and inflammation, right? You have COX-1, COX-2, and 5-LOX.
Okay.
And COX just means cyclooxygenase, which is better to say COX. So cyclooxygenase 1, cyclooxygenase 2, 5-lipoxygenase is the third one.
Okay.
And so you take aspirin to block and ibuprofen to block 1. You take Celebrex and Bextra and Movic to block 2. You take steroids to block 3.
Okay. It's a different pain
Medication-wise.
pathway,
Right.
essentially.
So think about like 3 doorways for pain and inflammation. So that's why if people have a lot of pain to start off with, they might take 1 ibuprofen, but they might still end up with chronic pain, so they keep going back to the doc and says, well, let's do a
He
COX-2.
adds that on. Okay.
So then you take Movic, and you can't take COX-1s for very long because 70% of people who have a COX-1 inhibitor, medication-wise, is shown to have a GI bleed within 2 weeks.
Wow.
So it's not a viable solution long term.
Wow.
So then they try to push everybody to COX-2s. But just like Vioxx got pulled from the market because part of blocking COX-2 enzyme blocks pain, but it also interferes with cardiovascular tissue, which is why Vioxx got pulled from the market and the rest of them got black box, because they caused 35,000 heart attacks during the study.
Oh my gosh.
And apparently they frown upon that when you don't report it, right? So they got pulled, but they didn't have really any other choice as far as replacement, so they just black boxed the rest and let everybody just get some cardiovascular damage as they chronically manage their pain.
Okay.
And then the steroid one, whether you get injected steroids that then destroy the joint, or you take prednisone, which causes diabetes.
Yeah, that's a tough
very,
one.
very quick.
That's
like
a hard one.
Blown up, right?
Yeah.
So whether they do any of those, that's why they do those things, right? So eventually someone will get steroid injections for their pain, and that'll work 6 months for the first shot, 3 months for the second, 1 month for the third, and then usually it doesn't have much effect. And by that time, you destroy that joint anyways.
Wow.
So why not do surgery? So
Right.
problem solved.
Right.
So with the gut stuff, same thing. Ibuprofen, can't take because you get a bleed. You already got a bleed. Then you'll end up taking the COX-2. And COX-1s actually decrease mucus, which is what protects your stomach from eating your stomach. So then you start eating your stomach, get ulcers and perforated ulcers, and it's a mess.
The layering up of medication is not the way to go.
Right. Right.
If you can avoid it, I mean.
Well, and that's what I love about gut patients too, is because there's not a lot of good options.
Yeah.
They're going to do pain meds until you end up with some horrible side effects, or they're going to end up doing chemotherapy or prednisone to shut your immune system off. But if you're young, how long can you do that? You're going to end up dying of cancer between now and then. So
say you're
they're not viable.
Say you're a person watching who's taking those pain meds, and that's helping because it's severe.
Yeah.
So what do you recommend if they're going to start taking omega-3s as an alternative? Do they just go cold turkey on their other stuff and start, or is it something they can keep in their regimen for relief?
Yeah.
Until they're able to transition. You see people who can transition.
Well, so it's a case-by-case thing because, if they're taking medication, we have 900 different drugs that we've created synthetically over the last 100 years, but they all came from something that worked naturally already. So if they're taking Mobic for pain and they take turmeric for pain, they're basically doubling up the effect, and then they might end up having more side effects from the medication, not from the turmeric.
Okay.
So we want to get them switched over. And so sometimes, it's working with their primary, who's the prescriber, or sometimes it's working with them for over-the-counter stuff. But they can't screw around with it. I mean, they've really got to just one or the other for the most part. It's just like Xanax and Valerian.
Yeah.
Nice.
Yep.
And you can't take those together because they both are they affect benzodiazepine pathways. Yeah. And so they will then make each potentiate the other one, and then you end up crazy drowsy.
Yeah.
So the anti-inflammatory foods like using ginger and turmeric on your food is crazy powerful anti-inflammatories. So if you put that on the fish, holy crap, that's awesome. If you made like a fish curry, that's crazy powerful anti-inflammatory.
Yeah.
And then even things like, reverse damage, so like rosemary, thyme, any of those herbs, like leafy herbs, they're all very powerful antioxidants. And in fact, they are 100,000 times more antioxidant than vitamin A, C, or E for helping reverse that damage.
Wow, I didn't know that either.
So while this person's doing this, they have chronic damage, and you got to basically knock down that damage, knock down the inflammation, knock down the pain from what's causing it in the beginning, and do the natural medication to decrease the that painful effect.
Right. And then that next step is searching out what your triggers are?
That's right. That's right. So we do the pain relief, and then we do the healing foods, which is just fruits, vegetables, nuts, seeds, berries, legumes. But we also have to figure out those triggers. The triggers are very unique for each person, and we talked about that when we did the case studies, and I uploaded those slides to you guys. But for this example, too, this was a great one, because this is the only time that I really screwed myself by making some really great recommendations that just did not work for this patient because of those sensitivities. And I told this person they were going to go away for a couple weeks, and so the test that we do, that blood IgG food sensitivity, that's 184 foods, right? So what it's looking for is, does your immune system attack this food through a process of molecular mimicry or T cell dysregulation? It's messed up. It's a cop that's confusing you for someone else, right? So when we test those, it takes about 2 weeks to get those back because they're delayed sensitivities. So for this patient, I mean, he was just a mess, the worst of the worst cases, right?
Yeah.
And so he said, well, what can I do in between? And I said, okay, eat lots of salmon because it's a very powerful pain reliever. Mm-hmm. Put lots of turmeric on there, lots of ginger on there because it's a very powerful anti-inflammatory. In fact, take ginger and lemon and puree it and put that in a glass jar and just put a little bit in your water every day to knock down that inflammation. And get rid of
ginger lemon tea in the morning.
Yeah.
Hot tea.
Yeah.
Yeah.
And then only eat a handful of things. I think we maybe gave him some brassicas or something like that. And said, look, just eat this handful of things, and it's the most anti-inflammatory, disease-reversing, healing stuff you can do, and keep track of it.
What about probiotics at that point?
Yeah, we do probiotics and B vitamins to amp up energy.
No matter what?
Right,
okay.
Right. And we'll talk about that in a minute. But when he got back, I'm glad he came back because he was worse. He was way worse. I mean, going 20 times a day, bleeding like a stuffed pig, mucus and crazy urgency, pooping on the highway stuff. And he still came back worse.
That is a highway to hell.
Yeah.
Go on. Sorry.
So, I said, well, we got your lab test back. Let's look at your lab and let's look at your food sensitivities and compare those to what you've been eating. And so I took my pink highlighter, because I'm a real man, and I took that pink and I highlighted everything that he had high sensitivity to. And there's I think he may be number 3 on our most sensitivities. We had a girl that had eczema from head to toe. She was our number 1 for years. And when we got rid of those sensitivities, all eczema is gone. 7 years, no eczema. The second one was a girl from, I guess it's a woman, not a girl, from Hayes, Kansas. And she became the worst patient we ever had with food sensitivities. And she lost like 80 pounds and all her menstrual stuff went away. And she was just like fabulous, like crazy fabulous. And then this guy. And so he had tons of foods, and he had lots of number 3s, which is the highest you can go. And holy crap, every single dang thing I told that dude to eat was on there. And not just on there, but the highest it could be. They were all 3s. And so I literally sabotaged his treatment because I couldn't effectively guess what his food sensitivities were.
Yeah.
And I just went with that, well, just do this and this should work. And so, I mean, again, out of all the patients, that's like the first time it didn't work. Just even when we first start out, we usually see people improve very quickly, and then we fine-tune out the big stuff with the test.
Yeah.
Oh, my God, he was worse.
So for those who are in real trouble, I have a friend I talked to just last night about her sister was in the hospital with colitis. Got down to 80-some pounds.
Yeah.
And doctor was talking about surgery. So the food sensitivity test would be a go-to.
Right.
For someone like a first go-to.
Right. And that's the bare minimum. I mean, you got to change that food, change that inflammatory part, but you have to stop causing the problem.
Yeah.
And if you push an immunologist to the very core of what's causing that condition, it'll always go back to T-cell dysregulation. And that is always goes back to molecular mimicry and double molecular mimicry for autoimmune stuff.
And if you're just joining us and you don't have any idea what that means, check out one or two or three of our previous. You check out our video with the dry erase board in the background, because he explains what T-cell dysregulation is and how that works and how autoimmunity happens. So
that's all drawn out. So it's pretty good. And then we had some mishap at the end that we lost everybody, but there's no closing part to it, but it gets through all that information. And so then with this guy, once we started getting, we've cut out all those bad things. And one of the things we do is Sherry, she's a wonderful RN. She actually takes that report and she writes up a new report that says, here's all the things you can have. And all they have to do is we get out of all the unhealthy stuff, all the inflammatory stuff, and all the IgG stuff. And then you have this list that's broken down into categories. And it says, just eat these things and you will heal up.
Yeah.
And so that's what we did. So we did that, and we actually increased like green tea because there's theophylline and epigalic acid in there, and that actually helps reverse genetic mutations, which is good. So that's kind of like proteogenomic therapy that we'll be talking about next month. We kind of do. I do that anyways. I just don't call it that. I guess we'll call it epigenetic therapy. But so then the next week, week 2. Is that rebuilding the immune system, and that's the long-term fix, right? That's what we want to see of how to stop that T-cell dysregulation. That's the etiology of all autoimmune. And so the 3 main things, and we talked about this on several of the videos before, but you have to cut out that 160 pounds of sugar that everybody eats.
That sugar thing is crazy.
Yeah.
Like, just even the fact that statistic about the teaspoon causing immune suppression for what?
30 minutes.
Yeah, that that was powerful for me. The statistics are powerful, so keep watching and keep getting that information that helps you make these decisions, because that was the decision to stop. It's even more powerful now, knowing that I've had my own struggles, and knowing that just cutting out sugar alone could boost my immune system by that much. That's powerful. And it's cheap.
Right.
You're not going to the doctor, and you can do this. So you're not spending money on the doctor, is what I'm saying. So.
And there's also a supplement every now and then for patients that just cannot get over the sugar part, called Gymnema sylvestra. And what it does is it desensitizes your taste buds to sweetness. And so then you're just like, every time you eat something sweet, it doesn't have any neurological effect on you, any sensational effect on you, and it's just kind of, it's like eating sand or something.
Yeah.
That's a good one. Dopamine is another one too for people for wheat, dairy, and sugar, which are all brain addiction foods, because sugar works like. Actually, you have more effect in the brain from sugar than you do cocaine, and it's more addicting than cocaine. And then wheat and dairy both have morphine in there, and so it's truly drug addiction. And so the worst case patients, we don't do that very often, but we'll do like a dopamine, which has mucuna in there, which actually increases your dopamine receptors in your brain. Or dopamine production, so then you feel doped, so you feel good, so you don't crave the morphine in the bread and the dairy to cope with life.
Hi, I'm Holly, and I'm addicted to sugar.
Yeah, and some people are like, oh, I love sugar. Well, sugar don't love you. Right? Sugar hates your body. Sugar's going to ruin your life.
Yeah.
So, now honey and maple syrup, molasses, those old school, that's not so bad. And fruit. Fruit sugars aren't issues. Now, if you have fruit extracted sugars, then that's a different thing. But sweet foods, that's what you want. Jams, not jellies, if that makes sense.
Even still, though, with fruits, we didn't always eat as much fruit as we eat now.
Oh, it doesn't.
Right?
It doesn't matter, though, because the the sweetest fruits have the most fiber, and the fiber binds to 80% of that sugar, and that feeds your gut bacteria, and that then makes more B vitamins. It makes you healthier and happier.
So it's still okay. What about for diabetics?
No, it's a myth. It's bullcrap.
Oh, wow. Okay.
Because the whole goal, where they kind of miss that, is that typically diabetic educators, how we live with diabetes, not how do we reverse diabetes.
But it's still the difference between orange juice from a bottle and an orange.
That's right. Yeah. Yeah, an orange, you're talking
Okay.
about 3 grams of sugar for every 15. Orange juice, you're getting 15 grams of sugar for 15 grams of orange juice.
Yeah.
Yeah. So that sugar addiction is a huge problem. That suppresses the immune system. So long term, the effect is not just get rid of these antigens. You have to actually stop suppressing the immune system. So the sugar is a big one that we have to systematically work with the patient from week to week, making sure that they are not overcome, that they're not going backwards with that, because it's such a strong coping mechanism within the U.S. And then cutting out stress. And that one, for men and women, it's the same. You know, it's eat for your hormones, stop exhausting your hormones. And that's a very tough one for patients to give up, because we hold on to that stress like crazy. I mean, we just thrive on it.
Well, and we have a culture of, if you're not working, if you're not doing something, then there's something wrong with you.
Yeah.
And so people are overworked, and they're pushing and pushing and pushing and pushing and pushing themselves. They're not getting rest. They're not enjoying their friends or the people that support them in their lives. They don't have time to exercise. They don't have time to meditate, or do those things that help that are just lifestyle wellness practices in order to reduce the stress.
That's right. That's right. And so, you know, we're human doings, not beings anymore.
Yes. That is, yes. Yeah.
Yeah.
Yes.
And what's crazy is you look at all the... I remember David Cross making fun of electric systems. And, you know, basically he's like, oh, this is where we are in America, that we can't do this motion. And so I'm like, that's what, we can't do that, right? Same thing with mixing. You can't mix. You can't do the old grandma beaters that my grandma had. So now we just push a button and it mixes.
Because we don't have time. We are too busy.
And then we get weaker. And then we complain that we're weak, and then our bones get weak, and then we go, why do we all have osteoporosis? Well, because you don't use anything. So then, instead of doing stuff like what's called activities of daily living or purposeful movement, we get weak and frail, and so then we go to a gym, and we pay to do the things we won't do on a daily basis. I mean, think about it. You drive to a gym to walk. What the hell?
So exercise, also a key component, or just movement, daily movement, a key component for stress relief.
It's crazy. So you got to either burn off the epinephrine, the stress, or you have to choose less stress. And so whether that's cognitive behavioral therapy, whether that's just choosing less, whether it's mindfulness, whether it's meditation, and literally, if de-stressing is difficult, then do it. That's more important. It's no different. Mind exercise versus body exercise, right? Well, I went to the gym and I got tired, so I don't want to do it. Well, then you need to do it. If you're weak, you need to do it. If you can't concentrate, you can't meditate, if you can't just shut out all the stress, then you have to work on it. And it's more important.
It seems counterintuitive, too, when you're feeling weak and tired and depressed, that's the one thing that keeps you from wanting to exercise or do these things. It's powerful, the feeling of not wanting to do those things. But you're right, that's the reason you have to get up and try. And it doesn't mean you have to go run a marathon tomorrow, but maybe getting up, doing some things around the house, or going for a walk outside your front door, rather than making a big production of it, is a good way to start.
Yeah. So that stress part's huge, because you have this process called gluconeogenesis. That's another good word.
Gluconeogenesis.
Can you break that down? Do you know what that means?
Gluco is sugar.
Sugar.
Neo is new.
Yeah.
Genesis is create.
Yeah.
Yeah.
So it's the creation of new sugar. So stress, whether it's true or perceived, makes your liver make new sugar like you ate a candy bar. So you can stress a Snickers and suppress your immune system, or you can eat a Snicker and suppress your immune system. And that's why stressed people get sick and cancer and autoimmune and fall apart and die.
This is for reals, folks. Yeah. For reals.
For real. So, that's that thing of like, was it zebras don't get ulcers? And there's another book about sharks don't get cancer. It's all these kind of silly things of like, if you don't eat crap and stress like crap and just live in the moment, then you're going to have a lot easier time feeling great. The longest living, healthiest populations on Earth, Costa Rica, Okinawa, Loma Linda, those kind of places, it's not some radical thing that they're doing. It's just a consistent lifestyle that's consistent with life and longevity.
Yeah.
And so that health and wellness is not a war that you're going to win or lose. It's that constant daily dialogue that you have with your food. It's all those little tiny choices that make the difference.
Yeah. And this could bring up a whole other live stream to bring this part up, but I know there are people who are, they're working hard to survive, and there's that economic aspect and that poverty aspect, and they're just working so hard to make ends meet. But it still seems as though there could be even just slight changes that can still be made.
Oh yeah.
For that person who literally can't stop because they have to have a paycheck coming in.
Yeah.
And really it does come down to what is it worth to keep going in that way.
And that's why I think that key is always progress over perfection.
Yeah.
We all live real lives, but how can we fit things in? And the questions, especially when it comes like, you have irritable bowel, Crohn's, you have life-changing inflammatory autoimmune conditions, it kind of changes your perception of priorities, It's like, am I just going to suffer for the next 40 years? Or am I going to make some changes and feel better and be normal?
Yeah.
And there's a great, I can't remember the name of this, but there's a great video online of a paratrooper that did so many paratrooping things in the military and jacked his back up, and all these doctors said, oh, you'll never be cured, you'll always have to walk with a cane, all this stuff. And this guy, you ever see this?
Mm-mm.
Oh, I can't remember the name of it. But so if somebody knows this, then put a link in for us. But he was told he'd never get better. And this guy went and met a yoga instructor. And the yoga instructor said, I don't know if I can help you, but we can try some things, right? And the body's resilient. It's always wanting to heal. It's designed to heal, given the right opportunities. And this guy I love because he did that humbling thing, which is he didn't video before and after and look at me. He videoed the struggle and the failure, the daily failure that he had to go through to get where he was going. Mm. And by the end of the video, he could run. He could run. No canes, nothing. He couldn't even walk without a cane. And this guy's running now. And everybody has that inborn ability. The body's designed to heal unless we're just screwing it all the time. And most people don't know what they're doing to screw it until they meet that person that says, hey, stop doing that thing.
Right.
Do this thing.
Right. They don't know that there's hope.
Yeah. I love that video. It's very, very inspiring. So the other thing is that it's chemicals. All the chemicals that we use, pesticides, herbicides, even cleaners and shampoos that are all toxic. I mean, they say if you drink this, you will die. But I'm just going to spray a little bit around the house and the kids and the pets. But the EPA says that if you spray 1 ounce of chemical cleaner in your house within 28 seconds, that's in every organ of your body. And if you want to know what causes autoimmune disease too, those chemicals that are in your house are horrible autoimmune inducing chemicals.
Yeah, I think we think because we're not drinking them,
right,
that we're not absorbing them.
Yeah.
But we're breathing them and absorbing them through the skin.
Yeah. And they kill pets all the time. And all we are, it's not like our dog has a different physiology. If our dog breathes in or licks those chemicals because they're sweet, and it suppresses their immune system and allows them to have autoimmune or cancer, which are the same thing on just opposite sides of the coin, then we have the same physiology. You and your dog have the same physiology. Me and my cat, same physiology, right? And so anything we do that screws up one species screws up all species. And so those chemicals we used to use old school grandma types of cleaners. Like if
Borax.
Yeah. Vinegar, water, like lye soap. I mean, if I use I use 1 part vinegar, 4 parts water to clean most everything. We have 4 kids, 4 daughters, and so we.
What'd you say? 1 part what?
I said 4 daughters.
No, but you said 1 part something to 1 part something to clean everything.
2 parts parents to 4 part daughters.
Oh. Okay.
Oh, the vinegar. Okay.
Vinegar. I thought you said
1
vinegar.
part vinegar.
1 part vinegar.
4 parts water.
To 4 parts water.
In a spray bottle.
To clean everything.
And if you spray your counters with this, and you accidentally spray some food, you just got healthier. If you're spraying the windows with this, and you spray the cat got healthier. If you're spraying this to clean the bathroom and your husband makes a smart-ass joke and you spray him, he just got healthier.
Right. You should probably just spray you in the mouth.
That's right.
For that.
Bad boy. Get out the bathtub. So, that's what you want to do. You want to use cleaners that you can literally just eat and drink, and you'd probably be healthier because of that. And so, this is important. You're going to love this. Studies show that those who don't keep a clean house or like sterile house actually have less autoimmune disease.
Woohoo!
Yeah.
People, get up and celebrate, at least those of you who are like me.
That's right. Anytime your spouse says, hey, we need to clean the house, you say, are you trying to kill me? You trying to give me an autoimmune disease? I'm trying to make this family healthy.
It's so easy.
Doing my part here.
It's so easy, people.
Yeah. So, that's one of the things. Chemicals, stress, and sugar. Those are those long-term, over the next 9 to 12 months, we slowly want to make sure that they get rid of those things, that they replace those things to where they have a sustainable lifestyle, to where they're not going to just end up back with irritable bowel, Crohn's, ulcerative colitis, or eczema, psoriasis, whatever else.
Yeah.
Right? And most people that get one autoimmune will end up with other autoimmunes. So same thing we did with this patient. We had to deal with those things. We had to get rid of the IgG stuff. And guess what? By week 4, dramatic improvement, right? And sometimes patients come in, it's just a crisis. It's like, it's all falling apart because they've seen everybody else. And then I want them to get better like right now. But we go through this slow, systematic process because we're not trying to just do a quick fix. We're not doing a gimmick. We literally want a sustainable change.
Yes.
And so it has to constantly be reinforced. So a lot of patients are like, well, do I have to come back every week? Well, because for the last 42 years, you have been living a completely unsustainable lifestyle that led you to have this horrific autoimmune disease. Well, we got to change that, but it takes time, right?
Right.
4 weeks is typically your amount of time it takes to change a lifestyle. So that's the bare minimum that you want to look at. So eating differently, drinking differently, behaving differently, responding differently. I mean, even the mindfulness causes 35,000 neurons to change in your brain through a process called epigenetics. You literally can teach an old dog new tricks. And we've learned this through something called neuroplasticity. And that neuroplasticity will allow you to then make these changes that are sustainable for the rest of your life so you don't revert back.
That meditation really helps boost the immune system too. Yeah.
Now this guy, he's the worst. So we had this is the only time we had to go this extra step, right? And this is a really interesting extra step. Mm-hmm. So we got rid of most his bowel urgency. We got him down to normal. He got off his medications. He was able to go camping with his sons, but he still had bleeding going on. And that's from that proctitis part, that really ulcerated part just at the very end of the colon. Mm-hmm. And so it's just like again, what's the expectations? I mean, I did a course through Harvard and, it was like, there's not a standard protocol for this when it comes to natural medicine. There should be, but there's not. So we're kind of flying by the seat of our pants sometimes with a lot of hopes and high expectations that usually pan out. But this time, there was still this one thing that wasn't happening. He still wasn't healing full thickness of that tissue, and he's still bleeding at that distal part. So, we got a little crazy.
Whoa.
So frankincense. So think of frankincense, very powerful anti-inflammatory.
Also an essential oil.
Right, as an essential oil. It has a chemical called in there called boswellia, and boswellia is the active ingredient. And it's from the sap of this tree. It's very moderately expensive kind of oil, especially if you get it from like one of those like Young Living or doTERRA or something. It's one of the most expensive oils. But it's a very powerful oil. And all he did was get over-the-counter stuff from like Now brand, right? So not even the greatest one, but it was 100% frankincense oil.
Now's pretty affordable too.
Right, yeah, and that's it's always that's your low end of the best, right?
Stuff.
It is always Now brand. And so I said, okay, we need to get frankincense oil directly to that area to increase the healing. Mm-hmm. And I said, this stuff is so powerful that when the wise men were able to give Jesus 3 things, they gave him a pain reliever, an antibiotic, which is myrrh, and some gold, which is just bling. Like I think it was a 4-finger ring that said Jesus on it or something, or Savior. And big medallion, so when he walked, it went like that.
Right.
So 2 essential oils and some gold, right? I like a gold tooth. Jesus. All right, that's not okay. That's not okay. No. So, all right. So I said, we're going to try Jesus oil and coconut oil on you, right? So then we took some coconut oil and some frankincense, mixed it up, and made little suppositories in the freezer. Not we, I guess he made it. I was just kind of like standing by, just like hoping for the best here. And so the idea was to put it in there far enough that he could actually get that frankincense directly therapeutic effect on his ulcerative tissue. And holy cow, the Jesus oil worked. That bleeding stopped, the tissue healed, full thickness, no mucus. Finally, he was 100% normal.
It's a miracle.
Yeah. So I said, hey, can I write an article for the paper about Jesus oil suppositories and how it healed your butt? And he wasn't okay with that.
Is that what you wanted to title it?
Right. I thought it was a good picture of him and a picture of his butt. And you know,
and he wonders why he wasn't okay with it.
Yeah, I don't know. That would be
Folks, he
so
is confidential with your health
his
information.
Name was Billy Johnson. So that's awesome. I mean, this is the worst case this guy's gastroenterologist, he's an old guy, has ever seen in his entire, 40, 50 years of practice. And within about 6 weeks, a couple months, normal.
That's amazing.
Absolutely normal. The dude was able to drive to Kansas City. He even remembered that he had to drive to Kansas City and no stopping on the side of the road. Like, that's amazing. We had a few others, and then even a year later and 2 years later, perfectly normal person now. And that's what we see time and time again if people follow that protocol. If they do the short-term elimination, anti-inflammatory, healing stuff, get rid of the IgG, and the long-term, getting rid of the chemicals, changing stress, changing sugar. If they do those things, it works. So another case, which I really liked, and if they're out there, they didn't pay their bill. You know who you are. So this person...
By the way.
Okay. So this person, it was a young girl, and she was having all kinds of problems with pooping herself and urgency, and it was getting out of control. And so they had seen everybody, and then someone said, you got to go see this guy in Kansas. They drove all the way to Kansas and saw me, and I said, hey, I think I know how to fix you. And we do this protocol, and her mom Facebooked me and said she saw her little girl praying by the bed, and she said, thank you, Jesus, that Dr. Garrett was able to help her have a normal gut. that she doesn't have to poop all the time. And so that was so sweet. And then they were talking about they went to the park for the first time, and they didn't even think about where a bathroom was. And for them, again, that's what I do. Well, maybe I'll occasionally look for a tree or something, like have a backup plan in case, drink too much water. But they didn't have to even think about where the bathroom was. Where before, that bathroom was the only occupying thought in their head was how do we get from point A to point B, and where's the bathrooms?
Yeah.
So that's amazing. You would have thought they paid their bill. They didn't pay their bill. That's cold.
That is
cold.
But we're here to help. We're here to help. We had some really great comments. Sorry we haven't gotten to you. Thank you for checking in with us, Rachel and Kendra, and a lot of other names. Linda. Who else have we seen tonight? Lissa and Brianna. David was here. Rachel was here. Hopefully you guys have made it to the end here. So grateful to have you watching.
I like Kendra's comment of Franken suppositories. I think that would be a good product. That's a great name.
Yeah. Yeah, we could market that.
That would be a good title for an ad in the paper. Yeah? Or like a treatment case thing or something.
Yes.
So Rachel, she said, how do you know if your meat's corn-fed? Whether it's organic. Now, organic can still get organic corn. Organic, now when it comes to meat, organic is a interesting term because organic junk food, like chips and ice cream that goes out of date, is often sold to farmers to feed their cows, and it's organic feed, so it's an organic meat, even though it was a 15-year-old junk food diet. Isn't that crazy? Mm-hmm. So so organic meat, that doesn't really tell us a whole lot. But what you want for, like, say, beef and bison is grass-fed, grass-finished, or 100% grass. So that's the key. Grass-fed only means they can still go to the feedlot for the last 6 months and get corn antibiotics. Right? So you want no antibiotic, 100% grass-fed. And I think most places, bison is always that. I don't think they can mess with bison, but I would always make sure of that. We even get bison from Dillon's, and it's, grass-fed, grass-finished. Mm-hmm. Now you pay a little bit more, but you're going to pay less for medications later. So that works out. And really what you're doing is you're paying the right price for meat. Meat's about 50% cheaper, I think, than it used to be. And that's because we eat 8 times more meat because they feed it corn.
Yeah.
So, I can make, I don't know, feed a cow chickens and sell it to you for $3, but that ain't going to help you, right?
Right.
I don't know if that sounds right. I don't know. But then with chickens, you want free range. Now, a lot of times they'll say vegetarian fed, but again, that's all. Well, okay, what are they talking about? Well, soy, genetically modified soy, is considered vegetarian diet. Corn is considered vegetarian diet, even though those are grains, and legumes. So that's not really a good one. So you really want free range. And free range, they run around, and maybe free range organic would be better, but to where they run around, and usually you're going to have to go to like your farmer's market or like, in Walton they have the Sims farm out there, which is really awesome, and there's other farms around, or at the farmer's market, there's lots of people that do the right thing.
It's really great to support your local farmers too.
It is, yeah. And when you can go to tour their facilities and look and see what they actually do, and that's important. And then with fish, it's always wild caught. That's that legal term. So when Rachel was asking about that, the meats, you want the legal terms, and that helps you out. So wild caught fatty fish will always be, eating seaweed and smaller fish that eat plants, and that's high omega-3s.
Yeah.
And Rachel said, I wish I could convince other people about the chemicals. But, it's hard. It really is hard because that's one of those things that I love when people bring the whole family in, right? When we do the report findings, bring your spouse in because it is so often that, like, the wife will come home, we got to make all these changes. And then the husband's like, you're crazy, right? which is how I would have been back
Right,
in the
because
day.
he didn't hear the science
Yeah.
behind it.
So we're like, man, bring him in or bring her in, and she gets to listen to the same spill, and he gets to ask those tough questions, and then I get to overwhelm them with evidence. So,
And he loves to do
Yes.
that.
and we've had several wives that are just like, well, my husband, you won't be able to convince him, and then it's like, I thought you were gonna have some questions. He's like, nope, sounds good. They just want to. Most people want to know. That's just not quackery. It's
Right.
not just gimmicks. It's not the next thing, on Dr. Oz, but it's real
Right.
substantial, evidence-based, best practices stuff that we're doing.
Right, and for the things that he doesn't know, he uses a magic 8-ball.
That's right. Try again. They should come out with a medical one of those. That would be great.
We could create our own one of those too.
What are some of the other questions?
We had what about chicken? We had, what else did we have?
The cheapest way to get chickens that are wild, free range, is to go at night. They're very docile. Climb over the fence, take the chicken. It won't make much noise, and then you got free range chicken for free.
Free.
I think they're free.
Range
I don't
chicken.
know. But we had some in our backyard, so we had chickens in the city limits, and it was wonderful. You go at night, and they're so docile, and you can just kind of pick them up and pet them. They're wonderful, and you get. Let's see here. Okay, and you can get different types of like Americana chickens, and they have different colored eggs. So you have green eggs, brown eggs, blue eggs. We actually had a black egg once, but that was from the duck. We had a black duck, and I didn't realize they had black eggs. But that was a big mystery. So for a while,
A very diverse group of poultry.
yeah. Like an Easter egg hunt every time.
So Lissa says, hi, when's the best time to call the office? She wants to get the ball rolling.
Okay. So yeah, if you want to make an appointment, we have free consults too, right? So we get an hour to kind of figure out if this is something you want to do. And our office number is 316-636-2888. Kind of a jingle.
It's great.
It's great. Skate.
Do you do Skype appointments for consults?
Yeah, so we have clients from all around the world, and we have some patients that fly in from other countries and other states. But in general, if patients are from out of country, we handle it as kind of health coaching instead of functional medicine, which is kind of same stuff, but that way we're not messing with, or that way it's all legal and proper for licensure. So, like we have patients as far as India and South Korea and Saudi Arabia and that kind of stuff. But we handle those as clients, and we can do those by Skype.
I have another question too on that. Tim is asking, where can we get this blood food test done if we don't live near Newton or Wichita?
That's a great question. So you got to find a doctor. So I would call the best test. Now, there's more expensive tests, and you'll hear like, oh, we've got to do all these things. But really, the most effective one for the last 13 years that I've done is through Allitest. Now, I've tried a few other ones. I didn't like them.
It's the what test?
Oh, the company's Allitest. Alletess.
Allitest.
Yeah, something.
Okay.
Test. Tess.
Oh, Allitest.
Yeah. And it's
Okay,
at foodallergy.com, I believe is their address. Or foodallergies.com.
Is that
something
right?
like that. Yeah, that's right.
Okay.
And I would call them and say, hey, I need to get this test done. I want the 184 food antigens. Who's a provider in the area that can do that? So some people have even come to Kansas for the test and then go back for the Skype. But again, it's a proximity thing. There's other doctors that do it. The only caveat is we charge dramatically less than everybody else. So, I mean, most people could buy a plane ticket, come get the test, fly back, and they still are going to be cheaper than what most people charge for that.
Wow.
So it's crazy because it's important. People need to be doing that.
Mm-hmm.
They need to be doing that lab. So you can call them. You can also reconnect. If you have trouble, you can always contact me, email me or Facebook me and say, hey, this is where I am. Do you know anybody in this area? And I've helped a few patients or people try to get connected with somebody that could do that lab. But there's other doctors. it's really funny because we had a patient, or sorry, not patient. Everybody's a patient, right? But when I was teaching anatomy and physiology, I was lecturing across the country, and I was teaching at a college, and I was taking a little time off practice, and there was a student that had horrible Crohn's, and she said, well, where do I get this lab test done? And so normally, I could do it, but so I said, well, call the lab. And so she called the lab, and come to find out her own physician does those tests.
Yeah.
So
check.
Then, right, no. So this gets better. So she goes to her doctor, who is her mom's doctor, who is her baby's doctor. She had seen him all her life, right? So, I mean, this is the guy. And so she says, hey, I found out you do this test. I want to see if I can do this test and it'll help my gut problems. And because she was taking Humira, which suppresses your immune system and then you die of like a toenail infection kind of thing. And so she said, she was so pissed, but she came back and she said, he was processing out loud and he said, could we do the test? Yeah. Would it tell us what you have sensitivities to? Sure. Could it help your condition? Yeah. But you're already on the medication. You're already, asymptomatic. Well, why change? And she said, can't this medication kill me or damage me? And he said, well, yeah, but if something happens, you just come here and we'll help you. And she was so furious she left. But he literally told her, yes, we could do the test. Yes, it would help. Yes, it would reverse condition. But you're already taking your Humira, so why rock the boat?
I think it's because to those with the philosophy of Western medicine, that seems more risky than just taking the medication.
Yeah.
I think that's the problem. And they probably don't feel that they have the ability to work with the patient going forward without that protocol in place.
Yeah. Well, and it's true. They get the information back. What do they do? Now, if patients, so we have a patient down in Florida, or a client down in Florida, that her daughter needs to get it done. And so I helped them get the kit. They talked to their primary down there, and he's all for it. He's starting to study functional medicine, so he's like, oh, okay, yeah. So he's willing to sign off on it, and then the records go to me because he doesn't know what to do with that, and then we help the patient. And so there's all kinds of, when it comes to like, it's not easy. We had a patient up in, or a client up in Manhattan, Massachusetts, which is actually, I think, where the lab company is. And it took months to figure out someone who was close, that had the right price. They sent her to this allergy clinic, but then the allergy clinic was like, yeah, we do the test, but, we don't like to do the test. We like to do the IgE. We should do the IgE. And I was like, no, I don't want the IgE because it doesn't help. I want the IgG. And so this whole mess. Just this whole mess. And finally they did the stupid test, and she was so much better. She had all kinds of weird autoimmune diseases, and all her labs were back down to normal, I think within a matter of a few weeks. It was insane. And her immunologist or her rheumatologist was just like, well, whatever you're doing is working. Keep doing that.
Yeah.
That's amazing. And so she was just blown away, And so if you have questions about the lab, just Facebook me through the messenger, and I'll try to kind of help facilitate direction for that. Sometimes it's easy, sometimes it's not, but we can help you push the right direction. Hopefully ask the right people. Okay?
Yeah.
Anything else? And Holly put that down on our thing there.
Yeah, it's in the comments. The
go.
Test, the type of test.
Yeah.
So.
All right. So, takeaway thoughts.
My takeaway thought, and the most interesting thing to me today, was salmon and the omega-3s as pain reliever. That's going to be my personal takeaway, like for myself, and then just that continuing, increasing hopefulness that I've been gleaning through this process of doing these talks, and hopefully you are too, and you're sticking with us, because as I also continue to experiment with what this dude over here talks about, I am noticing a difference in a lot of different ways with things I also thought were, that's not going to do anything. I had the same thoughts of it's quackery, or it's not going to be as potent, whatever he's recommending. So just hang in there with this process and keep learning as much as you can, and eat salmon and omega-3s.
Yeah. Quackery, huh?
He is a little bit.
Every time
he is a little bit of a quack.
No, every time I go to the duck pond, I start crying and run away because they're like quack, quack, quack. Was he doing natural medicine? Quack.
I already believed in most of it,
Yeah.
but there were just some things that I didn't put a lot of power or stock into. But because he explains the science, it's much easier to believe and try and experiment with.
Which, by the way, I'm really glad you guys view this and stuff. We have hundreds of views by the end of the week, and you can always look at the old ones too. But Holly's now famous, apparently. People are recognizing her from the video.
I'm really only here to become a star.
Yeah.
So, right.
So
I haven't done anything to really be here. Like, right. Yeah. I haven't accomplished anything. And that's what we do in America, is we become stars without accomplishing anything.
No, you're helping people.
Oh, I guess I am helping people.
Yeah, that thing. Oh, yeah, and we're helping people. So my takeaway is that this water tastes like vodka. So that's weird.
I don't know why it tastes like vodka.
I don't know.
I'm drinking kombucha.
I think it's vodka flavored water. Yeah, show them what you're drinking.
I get an A today for drinking kombucha.
That helps restore gut bacteria, makes you healthier, happier.
Probiotics.
Good stuff.
We're gonna come up with a jingle for probiotics. We'll have that next time.
Yeah. So my big takeaways are always just, as bad as it seems, there is always hope.
Yes.
I mean, I love the idea of seeing people's lives just turn around and they just get to be normal for the rest of their life. It's so awesome. It's such a humbling experience, but it's all just people are suffering and chronically suffering because of what their current doctor doesn't know usually. So I'm glad we're providing these, and I've had lots of good feedback that people love to have this information. I think one person that I saw the other day said, "Hey, I watch your videos," and they're like, "You got to stop telling people all the answers for free." So hopefully it's not all the answers. I don't know.
Right.
But hey, there's always someone that needs help.
Right. Right.
And then otherwise, next week we might have something, but we're not going to have a pre-packaged something because we're only doing 4 for this month. So hopefully we'll have a recorded one that we'll send out, or maybe we'll do a simple live, something simple. But otherwise, next month is super important. Next month is proteogenomic treatments for anxiety and depression. So if you know anybody with anxiety and depression that is hard to treat, is suffering, that they just can't seem to get their meds right, or their supplement right, or their lifestyle right, or their spouse right, because husbands apparently are part of the problem, tell them, right? And so we'll put that up, and again, keep sharing this information. Thank you so much for coming, you guys, and I'm really happy to be a part of your lives and your hope.
Thank you.
All right.
Okay. Oh,
Dun, 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 dun. Bye, you guys.
How do we stop?